Hello, ako si Kailan. Kayo niya nanonood ng bagong episode ng Newsbreak Beyond the Stories kung saan hihimayin natin ang mga maiinit at mahalagang isyu sa Pilipinas. Sa episode na to, pag-uusapan natin ang sitwasyon sa vaccination rollout sa bansa. Nagsimula na ang COVID-19 vaccination sa general adult population at mga minor de edad na may underlying medical conditions. Ang paglawak ng target na populasyon ay isang malaking hakbang patungo sa paglaban sa coronavirus sa bansa natin. Pero kailan ba maaabot ng Pilipinas ang vaccination target nito? Herd immunity lang ba ang dapat na tina-target natin? Ano-ano pang problema sa vaccine rollout ang dapat aksyonan ng gobyerno? Kasama ko ngayon si Sofia Toma Cruz, Raptor reporter who covers the coronavirus pandemic para talakayin ang isyong ito sa gabi na to. Hi Sofia, thank you for joining me today.
Hi, Jades. Thanks again for having me.
Bago tayo magsimula, I would like to remind our audience na pwede sila magtanong. If they have any questions about their topic today or any comments or opinion, they can comment down below and we will try to address this as the program progresses. So, start na tayo. Ang dami kong tanong, Sofia. Sofia, pwede mo ba kami bigyan ng update sa vaccination rollout sa Pilipinas? Ano na yung current rate na meron tayo at anong mga brandang available na?
Right. So, ano ba? 6 months na, 7 months since we started the vaccine rollout noong March 1. So, since then, in terms of people who have been fully vaccinated, mga 22% na tayo, hindi pa 2022, 20-22% na tayo. Tapos, in terms of first dose, around 25.4%. So, this is of the total population. So, siguro may mga ibang figures din na ina-announce ng gobyerno, pero yun yung mga figures of those are the vaccine targets according to the target population. So, yung measurement natin talaga is yung buong population ng Philippines. So, 22% fully vaccinated and 25% na first dose pa lang. Tapos, binanggit mo rin kanina, Jades, at this point in the vaccine drive, we've already opened vaccinations to all eligible adults, so the entire adult population. And for minors aged 12 to 17, nag-umpisa na yung vaccination for those with comorbidities, so yung mga A3.
And itong rate at numbers na meron ngayon, are these at par with what the government envisioned when the vaccine rollout began? Were there any adjustments made?
Mm-hmm. Well, if we go back to the initial target that the government made, gusto nila 70% by the end of 2021. So early in the year, if you remember, confident pa sila noon na parang kaya natin abutin yung 70% by the end of 2021. But here we are, October, 3 months left. And a few weeks ago, Vaccines Czar Carito Galvez Jr. was saying that, computations made, the most realistic target we could probably reach by the end of the year is 50%. So that's not 70%, but it's also a good number in the sense that 7 months ago we had nobody vaccinated, and so that still counts for lives saved. Pero yun nga, we missed the target for 70%, and that's due to a lot of issues. One being supply. So up until I would say around this year, this month, and sorry, nalilito na ako sa timeline of this whole pandemic. So around this month, October, no, and kind of September as well, more doses started to arrive in the Philippines. We have received, I think, 20 million already this month, and that's the largest shipment that we've gotten since we started the vaccine drive. Granted that it has increased every single month, pero significant. I mean, it's a really significant increase over the last 2 months, and that's good because whereas the first few months, yung main issue talaga supply. Ngayon, nakikita natin na yung isang malaking issue ngayon sa vaccine drive is really the efficiency of those rollouts. So, we're not, going back to your question, Jades, we're not at par with earlier targets na 70% by the end of 2021. What we could probably reach now is 50%. But if we miss that, I think one target that we will reach is yung target ng WHO to have all countries in the world vaccinate at least 40% of their population with one dose. So, kaya naman natin yung target na yun.
That's so many numbers, no? We have 70 the beginning, now
Yeah.
adjusted to 50, and then the WHO wants for at least 40%. Can
Mm-hmm.
we go back lang siguro a little and remind us, Sophia, ano ba yung factors or calculations or whatever process that they do to arrive at this target numbers?
Mm-hmm.
Siguro, I think yung pinaka-baseline, ano ba yung, paano nila ginagawa
Yeah.
to?
So, yung 70% pala, sorry, thank you for reminding me about that, no? Yung 70%, that number didn't come out of nowhere. Early on, officials were calling it, referring to it as herd immunity kasi akala nila, or at that time, the estimates was that 70% of population would need to be vaccinated for you to achieve quote-unquote herd immunity. Pero medyo complicated din yung usapan ng herd immunity. Siguro kailangan pa ng isa pang podcast para doon. Pero in short, it's where you get to this level where protection is afforded to people who can't get vaccinated. No, so you're able to protect people with lower immunity or weakened immune systems, and or who can't get vaccinated, and the virus isn't really able to spread so much anymore. In other words, the health crisis in is partly alleviated already. But so that 70% originally was estimated earlier on in the based on some numbers earlier on in the pandemic, where COVID-19 was thought to only be able to infect around 2 to 3 people. Um, and but we see that's not the case anymore. No, ever since then, especially with the rise of the Delta variant, na highly contagious, the most contagious out of all the variants so far, variants of concern, the number of people who can get infected has now gone to around 5 to 8. So because based on yung what you call a reproduction number, it was based on that, the 70%. Now that it's higher, um the herd immunity threshold, or the number of people that need to be vaccinated also has increased.
Yeah.
But I think
This
it's
will now,
important to
yeah.
emphasize na sorry, I think it's just important to emphasize na when we speak to experts, a lot of them always underscore that it was always an estimate at best. Kasi you really won't know with certainty. And I think that's what people really want, no? Yung certainty. You really won't know with certainty what that threshold is, but you have a ballpark, you have an idea of, the targets that you need to reach.
Yeah. So, correct me if I'm wrong, no? Pero at the very least 40%, realistically the target now 50, pero parang yung ideal 70. Parang in an ideal scenario na everything goes well,
Actually,
70 above.
oo, actually yung ideal na ngayon ay 90%. 90%
Yeah.
ng population. Kasi nga a number of factors. One being, like I mentioned earlier, yung Delta variant, pero may mga ibang factors din like the immunity, the length of immunity you get from a vaccine, and then the effectiveness of the vaccine as well, as well as the transmission of the virus. So there's so many factors to it. No, it's not just the Delta variant, pero the number that a lot of the scientists and experts are talking about now is no longer 70. It's around 80 to 90%. So let's just go with 90
Yeah.
percent for the for that's the number that experts always cite, would give or might bring a level of if you want to say comfort, yeah, to the situation.
Yes. Pero it's not the target of the Philippines now. Ang target nila ay 50%.
Yeah.
Yeah. So,
Yung target nila ay 90%, pero 50%, sorry, daming numbers, diba, Janelle?
yeah.
50% by the end of the year. Tapos
Yeah.
yung 70% na initial, gusto nila by election season, by
Yeah.
elections.
Yes.
Mabutan yun.
Sige.
Tapos 90% by the first quarter of 2022.
Sige.
Mhm.
So, gusto kong gawin parang mark yung election period. So, that's 70%.
Mhm.
Gusto ko, pag-usapan kasi scenarios with you. I know favorite mo pag, like last time we talk about scenarios. Gusto ko i-tackle first yung scenario na ma-achieve itong target na 70% by election date.
Mm.
Siguro na-achieve natin to. Ano yung important steps na the government should take to achieve this, to ensure na matutupad tong target na to by May 9, 2022?
Mm-mm. Well, I think maraming kailangan gawin. First of all, um, now that supply is no longer really an issue, kailangan na talaga i-improve yung efficiency of the rollout. And I think that I don't think there's any excuse anymore for you to not have figured out by now how you're going to roll out these vaccines. Kasi 7 months, we're 7 months into the vaccine drive already. Granted, some areas haven't been able to get as many doses, so maybe less practice, but there has been ample time for planning. And that when we say improve efficiency of rollout, maraming aspeto din yung um, involved dito. First, I mean, for example, one would be registration. So, um, there have been a lot of novel efforts by local governments in the past few months. If in the beginning we all started with online registration, um, nakita na natin na hindi sapat na online lang yung registration. Kailangan may on-site registration. Kailangan siguro sa ibang LGUs may mga house-to-house vaccinations rin for seniors na no, they know where the seniors are and they schedule and they plan how to reach all of them. They don't leave it to the seniors to um, sign themselves up. So, for example, registration, there needs to be, by now, there should have been or there should be efforts on the way to really expand registration and access to registration. Tapos yung transportation of the vaccine doses from the hubs to the centers. I think recently, si Galvez was mentioning that this is one area that they really want to cut down time, that they really want to shorten. So if if before yung issue was supply, now na nandito na yung mga doses, it looks like nahihirapan din yung transportation, the effort to transport them from warehouses to vaccine centers where people will receive them. I think Galvez mentioned that it takes around 7 to 9 days. So it's really long, especially if you want to be able to vaccinate. Here, another number, another target. They want to increase vaccination to 1.5 million doses a day. But that's I think almost triple what we're at right now, which is around 400,000, ballpark figure, 400, over 400,000 to 500,000 doses. So, um, registration, transportation, and then also the system in vaccine centers itself. Um, you've had your shot na Jades. I've also been able to get vaccinated already. And when we were there, mahaba pa rin yung mga lines sa vaccination center kasi daming stations. So now that more people are even eligible to get vaccinated, there will be more people going to vaccination centers. And just the management and flow of people is something that can really affect how fast you vaccinate and how many doses you're able to, and how many people you're able to vaccinate each day. But you were talking kasi a lot about targets din, no, Judes, and we were mentioning all these goalposts, para 50%, 70%, 90%. Pero I think kailangan rin i-note na parang aside from all these numbers, isang primary objective rin talaga kasi ng vaccination is to prevent deaths and hospitalization. So kung I was gonna say, if you remember early on in the pandemic, I wouldn't even go as far back as early on in the pandemic, but where we're still at right now, maraming hospitalizations pa rin, tumataas pa rin yung mga deaths. And that's one thing that's one primary objective of vaccination, really, to prevent those deaths from happening. And now that vaccines are available, it's even more important that you prevent people from dying, because if in the beginning there was no vaccine, there was no way to prevent them from dying in a way, now there really is. And so I think aside from reaching those goalposts, the 50%, 70%, 90%, isang isang target, if you want to call it, yeah, we can call it a target. One target that experts really, really, really want to keep pushing at is vaccinating the elderly, so senior citizens and people with comorbidities. Kasi sila talaga yung pinaka at risk of dying from COVID-19, and that hasn't changed since the start of the pandemic. It hasn't changed now that vaccines are out. Actually, I think it's even been reinforced more that vaccines are out because um for example, kagaya ng isang I think isang recent study ng CDC, so the Centers for Disease Control in the US, that a lot of countries look to for information as well kasi may data sila, tas established na sila. They found that age itself really is a risk factor. So whether or not you're vaccinated, a vaccinated person is still more at risk of dying than a younger person who's vaccinated. So like I said, it really underscores the effort and the importance of making sure the elderly and the people with comorbidities are vaccinated. Kasi you can talk about 70%, 90%, 50%, pero kung maiiwan yung mga elderly at maiiwan yung mga persons with comorbidities, you'll still see a lot of pressure on the health system. Kasi ilang yung mga beds lang dito eh, thousands, and there are millions of them.
That's a really long laundry list for the government to achieve yung goalpost na sinet nila, no? Pero yung next kong scenario is hindi natin ma-achieve tong target na to
Mm.
by May 2022. Ano yung parang posibleng mangyari that can lead to this bad scenario? Ano yung mistakes the government can do na pwedeng
Mhm.
masira lahat ng plans nila moving forward?
Mm. Alam mo, well, from what we're seeing now, I think one thing that we haven't paid attention to, or one thing that officials might need to go to shift their attention to more, is the issue of vaccine hesitancy. Um, Baka akala kasi ng mga ibang tao na parang, ang dami namang willing to be vaccinated. So what vaccine hesitancy are we talking about here? It's the access that people that is lacking. But now that supplies are arriving, we've seen in other countries that vaccinations will really go up for a while, and then it'll hit a wall, and that wall will be people who are not willing to get vaccinated. I don't know, Judas, pero may kilala ka ba na hindi pa willing to be vaccinated kahit eligible na sila? Kasi I
I
know
know a
people
lot.
personally
Yeah.
who still don't want to get vaccinated.
Yeah.
And so just the very fact that people who still aren't willing to get vaccinated, shows you that hesitancy still is an issue that needs to be tackled. I think that it goes beyond. If in the beginning it was all about brands,
Yeah.
I think it goes beyond that now, and so I think that's one thing that might derail the government and derail us from reaching the many targets that we talked about so far. At the same time, um, yeah, I think that's one big issue. Kasi granted, wala pa namang latest surveys on vaccine hesitancy, pero the most recent ones, it's still pretty significant the number of people who don't want to get vaccinated.
Yeah, and speaking of vaccine hesitancy, no, what can you say about the government when it handles vaccine hesitancy? Meron bang parang improvement? Kasi as we
Mm.
recall, just last week, narinig natin si Presidente Duterte, sabi niya tuturukan ng vaccine yung mga tao habang tulog. I know it's a
Yeah.
joke, pero what does this say about the government's handling of the very real problem of vaccine hesitancy? Kasi of course, the President is
Mm.
the weekly, twice a week nasa harap siya ng maraming tao. Pero yung mga nilalabas yung mga salita about vaccine hesitancy addressing this problem is
Mm.
pero problematic. What did you say about how the government handles this issue?
Alam mo, I don't think they take it seriously. I don't think they might know how serious the issue might be later on. Kasi, um, kung, kung napapansin mo yung situation sa ibang countries, it's really the issue that, for example, let's just look at the US, for example, right? They are swimming in vaccine doses, yet only, well, they definitely haven't reached the 90%, for example. And that still puts a huge strain on their healthcare system because there are people who don't want to get vaccinated, and it's making life kind of hard for other people who are um, vulnerable to COVID-19, who can't get vaccinated, and it puts others at risk, right? Um, but I think that the messaging here, for example, President Duterte saying that he wants to vaccinate people in their sleep, or people, or just the messages so far, for example, of officials saying that um that's why Duterte needs to keep asking people to get vaccinated, telling them this is the only way we'll go back to normal. I don't think it really shows a full understanding of why people might be hesitant. If you and and I think it's really hard to get there's so many reasons why people are hesitant, right? It can be because they're really anti. It can be that they just have some concerns about safety. Pero if you look at the context of the Philippines, the biggest concern always is a safety. It's always safety concerns. Will I be okay after I get vaccinated? I heard about someone who got sick. I heard about someone who might have died after getting vaccinated. And you saying that I want to vaccinate you while you're asleep, or um we want don't mind the brand anymore, or what are other messages that it's the only way we're going to go back to normal, that doesn't really address the main concern
Yeah.
that people have. So if you have, I want to know if there are officials who are having those conversations with people who have yet to be vaccinated in communities, and you know and learning from that, because if they were, I think it would reflect in their messaging, pero sa ngayon parang hindi pa eh.
Parang ano, like from what I've gathered from the way the president addresses this issue is very force, like very strongman,
Mm.
dictator, like tyrant.
I
Uh,
order you to do
hindi
it, oo.
Yeah, o
Mhm.
aarestuhin kayo, hindi ka habang tulog kayo acting kayo sa bahay. Very similar
Mm.
to the Tokhang 'no, na pupunta sa bahay, kukunin kayo 'pag di niyo ginawa yung gusto nila. Pero from what I'm getting from you is, sabi mo nga kanina, maybe the government should, talk to the people on the ground, parang mag-FGD kung ano yung
Or
dapat yung
oo,
oh,
or kahit kung walang oras, let's say, to talk to everybody on the ground, to talk to the health workers, the health workers in the local health centers. They have so many insights about what people are scared of. And
yeah.
they can already, there's also a wealth of experience and information that's already out there based on, let's say, yung measles vaccination programs, polio vaccination programs. So we're not, again, we're not starting from scratch. Let's not think na, oh my gosh, this is such a big task we have to do. Like there's already a place to start. So yeah, if they don't want to talk, if there's no time to talk to people on the ground, no time to do FGD, although it really is worth the time. um Talk to your local health workers and ask them what they've learned so far from the past few months.
Yeah. Do you think what would be the good messaging when it comes to addressing vaccine hesitancy? Do you think one big factor or one big good way to do this is by dispelling the misconception or the disinformation surrounding vaccine in the Philippines? Kasi di ba ang dami-dami nun ngayon?
No, definitely. I think, like I mentioned no earlier, parang um, there are so many different reasons why people might not want to get vaccinated. So I think that it's hard to define what would be the correct or best type of messaging. But I think what one thing that's really important to do is really to go out there and talk to people, because it's not coming from nowhere itong approach. For example, yung WHO, ito rin yung actually it's in their website, like
Yeah.
how to tackle vaccine hesitancy. You need to talk to people, you need to have those conversations, and you need to accept, for example, that it might not be a one-time conversation. It's like a ongoing conversation that you need to have, and it can take really long. But at the end of the day, it's really worth the effort, because for example, if I can convince you to do it, somebody who's hesitant, maybe that person will go on to convince somebody else. And interestingly enough, for example, we already see that happening here kasi in the Philippines and the Bajudes. So isang question din ng mga recent surveys was, aside from are you willing, what are you scared of, there was actually one survey done by Pulse Asia months ago that asked what would make you change your mind. And it's really, one thing was the biggest thing was really that seeing other people that they know get vaccinated and them being okay and them being safe afterwards and them sharing their story na, hey, look, I got vaccinated, everything was okay, I'm fine. That was one factor that really got people to say, okay, fine, I'll get vaccinated. Um these it wasn't the kind of messaging that says like you have to get vaccinated or you can't go out of your house, or you have to get vaccinated or vaccinate you in your sleep kind of thing. Like it's
Yeah.
not the kind of messaging that people respond to.
Yeah. So, from that issue, punta tayo ngayon sa latest developments sa vaccine rollout na pag-open sa general adult population and children with comorbidity. What do we need to know about this, Sophia? Like, siguro, news you can use tayo ngayon dito. What
Mm,
what do I need to do if I want to avail this vaccination if hindi ako pasok dun sa mga previous
mm,
priorities?
right. So, punta tayo muna sa vaccination of minors with comorbidities, no? Um, well, hindi pa ito available sa outside um nag the pilot run is still going on in Metro Manila. And the only time that it will be available in your LGU is if at least 50% of the elderly population is already vaccinated. So at least here in Metro Manila, it's only uh, being run right now in five cities in 8 pilot hospitals, but it's going to expand soon to all 17 cities in Metro Manila, and there will be at least one hospital in each LGU where minors can get vaccinated. So, if you're in an area where vaccinations aren't open yet, for your child or for somebody you're looking after who's age 12 to 17 with a comorbidity, you should check your LGU first if registration is open. And if it is, sign your child up. And if it's not, just keep monitoring for when it's going to be able to open. And for vaccination of adults in the general population, if at first you didn't fall into a 1, 2, 3, 4, or 5, now's your chance to go get vaccinated, and now's your chance to sign up and get your shot. Rapper also has a really extensive list of guides um, and explainers on what you can expect in the vaccination center and what you need to bring. So perhaps you can also share that again later on.
Yeah. And then, siguro, my second to the last question is, ano yung parang things na you think remaining pa rin na problema given that we're almost 7 months into this rollout? Ano
Mhm.
yung parang persistent issue na nakikita mo on the ground? And how can the government address this? Siguro, at least yung, hindi naman yung sobrang like the vaccine hesitancy, pero yung is something na alam mo naman na pwede siyang maayos in just one flick of a finger, or maayos just by putting attention to it, but hindi ginagawa ng government. May nakikita ka bang ganong
Mm.
issue?
Um, yeah, I think for example, now that there are more people who are allowed to get vaccinated, yung children with comorbidities, 12 to 17 years old only, sorry, and the rest of the general adult population, I think that aside from putting up priority lanes in these centers for priority groups A1 to 5, there needs to be a more concerted effort to get seniors vaccinated and to get persons with comorbidities vaccinated, because I think right now we're only around, I think if I'm not mistaken, we're only a little over 4 million, maybe almost 5 million seniors fully vaccinated. So um there's still around 3 million who haven't been, and even more for persons with comorbidities. And again, going back to um, vaccinations and it alleviating and it preventing deaths and hospitalizations, there's still millions out there who aren't vaccinated. And if you're thinking about, a sense of normalcy and a sense of the crisis being less of a big crisis as it is now, we're still not in the clear yet. And then what I mentioned earlier, yung hesitancy, whether or not you I it would be good to see more conscious effort to um, respond to the fears that people have and the apprehensions they may be having about vaccination, all the more because our targets have also increased, right? So hindi na 50%, 70%, pero 90% yung target natin. And let's just say at least 90%
Mm.
because um there's nothing stopping that target from moving further up. Um the virus could still evolve, and it's always better to aim for higher for a higher vaccine coverage, and it's really not impossible to reach that. But if we don't address the hesitancy, it will almost be impossible to reach that, even if you have you know all the vaccines in the world. If people aren't willing to get vaccinated, then you won't reach the 90%. And if you try to vaccinate all the willing, um, and you don't make an effort to really make sure that your elderly and your people with comorbidities are protected, then it will be the same situation that we see right now. Hospitals being overwhelmed, there not being enough beds, the crisis still being a crisis, and aside from that, the improving the efficiency of the rollouts, right? So, like we mentioned earlier, are all people part of the indigent population, na A5 group, registered already. If they're just waiting for their shot, then okay. But if they're not even registered yet, then maybe it's good for LGUs to look at how to register, how to get all of them registered, at least all those who are willing. And I think one interesting thing that we will be watching in the next few months is vaccine mandates. So na-mention rin ito ni Secretary Galvez kagabi. Yeah, okay,
Mm.
yeah, last night, that the private sector is very much interested in implementing vaccine mandates, which we've seen in other countries to be very helpful in increasing vaccination coverage. They're not everything, but they're really very helpful. So, for example, you can't go into certain establishments unless you get vaccinated. Certain workplaces will need to can institute vaccine mandates to get their employees vaccinated. Um, Government, for example, can also institute that to make sure that workers in government are protected. So all of that put together, like mandates in all these different places,
Mm.
could also be something that increases the vaccine coverage in the next few months.
Yeah. Pero, like, balik tayo dun sa pag-widen ng
Mm.
coverage, no? How crucial or big itong decision na i-open siya sa general adult population? Like, is this a big step considering the situation that we are in now?
I think it's a big step kasi um, you know for the longest, this is, well, one thing, this is what people have been wanting for the longest time, to be eligible to get vaccinated. So it's a big thing that COVID vaccinations are now open for everybody in the adult population, because there's basically nothing stopping you anymore from getting vaccinated if you don't have a medical condition that prevents you from doing so. So it will really see our numbers increase in the next few months. Um, we started vaccinating people in the general adult population just earlier this month. I think 2 weeks ago, October 7, and already I think over 200,000 um, people have been fully vaccinated in that group. So just imagine, yeah, nearly over 200,000 and nearly 800,000 have gotten their first dose. So, that's a million people who who may be fully vaccinated um in a matter of days already, and that's really going to help reach our targets, and it's really going to help us increase our vaccination coverage. But then again, um that really can't come at the expense of making sure that you reach your senior citizens and your persons with comorbidities, because they can't get left behind at the expense of um reaching that number.
Yeah. And for my last question, medyo baka pessimistic note to end to. As someone who covered the pandemic since like the first few months, someone who's been deep in what's happening now, what worries you right now, Sophia, when it comes to the vaccine rollout, the targets that we have, and the situation that we have now, if you put it everything in context? what's worrying you about our situation and the foreseeable future when it comes to the pandemic in the Philippines?
Mm-hmm. I think what's worrisome is that, well, let's acknowledge know where we are right now. We're at the point where cases have um been decreasing, which brings a little room to breathe, because well, for one, for our hospitals and our health systems, they've seen the most number of hospitalizations that they've had in the whole pandemic, in just the past few months. So um I think that yeah, we're at the place right now where we have room to improve. So what worries me is that we waste another opportunity again of this cycle already that we're in, to improve and change what's going to happen in the next few months. Um, Otherwise, we might just see a repeat of the whole thing. Another surge in a few months. Our health systems stretched even more thin in the next few months because we didn't take the opportunity that we have right now to improve, not just our health systems, but really everything else. Access to testing. I think earlier in the year, middle of this year, around June, July, we made an effort to speak to a lot of experts about what they wanted to see the government do in the next few months, up until June next year, so a 1 year time span. And we really emphasized doable actions. So improving ventilation in public spaces, in malls, in all these places. Um, it was a long list, 10 items, but all doable. So I think one thing that worries me is that we waste this opportunity to check some of those items off. And um it's I think that one thing that worries me is that it's the pandemic really isn't over yet. Vaccines are here, and more people are getting vaccinated every day, and that's good. But like all experts have said and repeated in the past few months, because I think it's worth repeating really, is that, you know, um it's also a race against time already. Like, things need to happen quickly, transmission needs to be cut quickly, vaccinations need to go up quickly, because the virus is still here and it's still spreading. And as long as it's still spreading, it can mutate and it can evolve into a more dangerous form. And we already saw what Delta has brought to not just the Philippines but the rest of the world. um not to scare anybody or anything, but um yeah, experts have said just in the last few days, there's still a lot of potential for the virus to keep evolving, and there's a lot of what they call evolutionary. There's a lot of space for the virus to keep evolving and evolving, and you don't want to give it that chance to evolve into something more dangerous than Delta, because then I don't know. Let's not contemplate the situation even. Let's not go there
Na
yet.
napa-retrospect ka sa tanong ko na yun 'no.
Mhm.
You gave us like a hard punch of reality na even if
Mhm.
like for example, cinemas are opening, napa-lower
Yeah, the
yung
next
alert.
few months are so crucial.
Yeah. So,
Yeah.
thank you so much, Sofia, for joining me today. Ang dami-daming ko nalaman today, especially dun sa moving goalposts natin and bakit hindi lang dapat yung tignan-tignan na natin yung mga mga capacity at ng mga hospital
Mhm.
and then yung numbers ng deaths kasi kailangan din sila mapabawas para hindi mag-collapse yung health system natin. So for our viewers, kung gusto niyo sumali sa discussion na 'to or other issues in the Philippines, puwede kayo sumali sa Facebook group ng Rappler. Rappler Room siya, nasa Facebook siya. Kung gusto niyo naman na pumunta sa discussion na election related, puwede ka sumali sa PH Vote sa Facebook. Nasa Facebook group din siya sa Facebook. And ayun, thank you so much, Sophia, for joining me today and for explaining all these things to me, to our viewers. And I'm sure, sabi mo kanina, ibang episode yung herd immunity, sobrang haba niya. And I'll
Yeah.
make sure to ask you to come back again in the next weeks, especially if we want to reassess what's happening now, lalo na papasok na yung holiday season.
Mhm. Yeah. Thank you to Des for having me.
And for our viewers, thank you for watching. Kung gusto niyo sundan ang issue na to, huwag kalimutan na palaging bisitahin ang Rappler website. Kung hindi niyo pa ginagawa, i-like at i-follow ang Rappler sa Facebook, pati na rin sa Twitter. Pati na rin ang Newsbreak, ang investigative arm ng Rappler. Samahan niyo ulit kami next week para sa bagong episode ng show na to. Ako si Judas Gavilan and this is Newsbreak Beyond the Stories.